morning. Welcome to today's presentation. We are going to discuss hemorrhoids. We'll discuss hemorrhoids. So by definition, hemorrhoids is the dilatation and swelling of veins around the anus or lower rectum. The dilatation of veins and swelling of these veins around the lower rectum. So what we're trying to mean here is the veins around the anus and the rectum, they undergo dilatation. They undergo dilatation. So when they get dilated, as we all know that the anus, the rectum, after some time, they need to excrete stool. So the stool that passes through the dilated veins around this area, the stool tends to come out with blood. Because of the space that has been reduced due to dilatation of the veins around the anus and the lower rectum. Let us look at the causes of these hemorrhoids. The first cause is straining at stool. Straining at stool. When you are straining when you go to defecation. Then pregnancy. Those who are pregnant, expecting, there is so much pressure that is exerted on the rectum and the anus, predisposing them to the hemorrhoids. Also aging. It is just necessary that when someone starts to age, the number of body systems and organs, they tend to deteriorate in the manner that they have to function. And one of them is the rectum as well as the anus, where they undergo dilatations leading to hemorrhoids. Also chronic constipation or diarrhea. Chronic constipation and diarrhea can bring about hemorrhoids. So in chronic constipation, we all know that in constipation there is hard stool, and that hard stool, when it is going through the anus, the rectum, in a space which is already reduced due to dilatation of veins, you find that the stool that is coming out from there, it will be mixed with blood because of hemorrhoids. Also, anal intercourse. Anal intercourse. Those who likes having sex through the anal region instead of the usual way, they may predispose or they may be at risk of having hemorrhoids, because the anus and the lower rectum gets injured in the process of having sexual intercourse. In the end, they undergo dilatation, reducing the space that when the stool is coming, it comes with the blood. Let us look at types of hemorrhage. Types of hemorrhoids, I mean not hemorrhage, but types of hemorrhoids. There are basically two types of hemorrhoids. Namely, we have what we call internal hemorrhoids. Internal hemorrhoids, these are found inside the anus. Internal hemorrhoids, these are found inside the anus. We also have what we call external hemorrhoids. These are found under the skin around the anus. These are found under the skin around the anus. So these external hemorrhoids, they are the ones which you are actually able to see protruding outside of the anus. So when someone has hemorrhoids, how do you know that this individual has hemorrhoids? So the signs and symptoms of hemorrhoids includes bright red blood stool, especially seen on toilet paper. I don't know. So when someone has hemorrhoids, they go to defecate. Like I said, stool comes out with blood. So when you want to clean yourself after defecating, the toilet paper that you use, it is actually going to have blood on it because of the continued bleeding that is coming out from the anus. Protrusion of hemorrhoids through the anus to outside the body. In an example that I already mentioned to you, that we have two types of hemorrhoids, the internal and the external hemorrhoids. So when someone is having external hemorrhoids, I mentioned earlier, so these external hemorrhoids, they'll be able to protrude outside the anus. So this is where I'm saying there'll be protrusion of hemorrhoids through the anus, the outside, but they'll be looking like some polyps. So when you go to defecate, you'll be able to see some polyps hanging around within the anus. So this is what we mean by protrusion of the hemorrhoids. There's also pain on defecation. I don't think it is normal that when you go to open the call, when you go to answer the call of nature, you should be experiencing pain. You're actually supposed to enjoy, feel like you're at home, you know. So when you're feeling pain while defecating, it simply means that there's something wrong within your system, and this could be pain coming from coming due to bleeding around the dilated veins around the anus. Then pain, swelling or hard lumps around the anus, which I said they look like polyps. Pain around the anus when you're walking, because these veins, they are dilated, they get much space on the anus, and they'll start to come together. So when they come together, as you'll be walking, there'll be that friction where pain will be coming from. Let us look at the investigations that can be done in hemorrhoids. The first investigation that we have to do in hemorrhoids is history taking. History taking is very paramount. Bleeding from the rectum or blood in stool, if there's blood in stool. So the type of history that you need to find out from your client, the patient, is about history of bleeding from the rectum. And if there is blood in stool when defecating, that history is very, very important for you to diagnose hemorrhoids. Also, clinical presentations such as pain on opening bowels. Clinical presentations such as pain on opening bowels can also make one of most milestones in history that you can collect from a patient who is presenting with the signs and symptoms of hemorrhoids. Apart from history, you can also do what we call anoscopic examination. Under anoscopic examination, you are going to view the internal hemorrhoids. Like I said in the beginning, that we have two types of hemorrhoids, the internal hemorrhoids as well as the external hemorrhoids. So it's quite impossible for you as a clinician to see the internal hemorrhoids without the aid of an instrument to help you visualize the hemorrhoids. So one of the instruments that can be used for you to determine, to know that the client is having internal hemorrhoids is anoscopic examination. So you're going to use an instrument that will allow you to visualize the internal sphincter muscle. Another examination that you can do is digital rectal examination to feel for dilated veins. Digital rectal examination to feel for dilated veins. So under digital rectal examination, you put on clinic gloves, like you know that the anus is not stellar. It's one of the areas that are dirty from the body. So you just need to put on clean gloves, then get your finger, poke it inside the rectum, feel it around it so that you are able to confirm if there are any veins which are dilated. We continue with investigations. Another investigation that you can do in hemorrhoid is proctoscopic. Proctoscopic. Proctoscopic examination to view the entire rectum. Proctoscopic examination to view the entire rectum. So those are the investigations that can be done to find out if someone has hemorrhoids. You can also do these other supportive examinations like a full blood count, just to know the HB of the client due to the bleeding that we've already mentioned in our discussion. Let us look at the management of a client with hemorrhoids. Let us look at the management of a client with hemorrhoids. One of the things that can be done in the management of client with hemorrhoids is seize baths. Seize baths several times a day to help healing and relieve pain. To help healing and relieve pain. Application of hemorrhoid cream helps to relieve pain. You can get what we call hemorrhoid cream and apply it on the hemorrhoid so that pain can be relieved. Apart from hemorrhoid cream, we also have anti-hemorrhoid creams. So anti-hemorrhoid creams can be used in an event where you want to prevent hemorrhoids. But when hemorrhoids have occurred, there is no point in preventing because the problem has already existed, the problem is already there, and your immediate task will be to treat. That's why we urge you to apply hemorrhoid cream. Among the management, also diet is very important. Eat diet rich in fiber and drink a lot of water to avoid constipation, as straining at stool causes pain and bleeding. So you need to eat diet that is rich in fiber to avoid constipation, because when you have constipation, this will also increase bleeding when defecation, because the hard stool will be damaging, will be bruising the small blood vessels that supplies the mucosa of the intestine. Rubber band ligation. Rubber band ligation is also one of the things that can be done. Okay, so I was saying rubber band ligation can also be used in the management of a patient with hemorrhoids. A rubber band is pressed around the base of the hemorrhoids inside the rectum. So a rubber band is pressed around the base of the hemorrhoids inside the rectum. The band cuts off circulation and the hemorrhoids withers away within a few days. So when a rubber band has been inserted, it cuts off the circulation of blood to the hemorrhoid so that the hemorrhoids can shrink and wither eventually. So in doing so, the hemorrhoids will be treated. The other method that can be also used in the management of hemorrhoids is sclerotherapy. In sclerotherapy, a chemical solution is injected around the blood vessels to shrink the hemorrhoids. A chemical solution is injected around the blood vessel to shrink the hemorrhoids. So when the hemorrhoids get shrinked, then they wither and die a natural death. Apart from sclerotherapy, we can also use infrared coagulation. Infrared coagulation, a special device is used to burn hemorrhoidal tissue. A special device is used to burn the hemorrhoidal tissue. So in infrared coagulation, the hemorrhoids are being coagulated. The hemorrhoids are being coagulated just like we coagulate in theater using the diatemy machine. If we have done our level best in trying to treat this patient using various methods of treatment and they've been unsuccessful, we are left with one option, that is the hemorrhoidectomy. So this leaves us to surgical removal of hemorrhoids and can be done for both external and internal hemorrhoids. So hemorrhoidectomy is the surgical removal of hemorrhoids. We've done all interventions by means of medical interventions as well as radiotherapy. It hasn't worked. So the only option that we are left with is to get rid of the hemorrhoids by means of operation. So surgical removal of hemorrhoids is what we term as hemorrhoidectomy. Now let us look at the preoperative care of a patient who is going for hemorrhoidectomy. As discussed earlier under general preoperative care, so what we mean by as discussed earlier on, we mean patient can be prepared like any other patient who is going for general surgery of the GIT. Patient can be prepared like any other patient who is going for surgery of GIT or surgery of the abdomen. Let us look at postoperative care. When the patient has come from theater, they've done hemorrhoidectomy, what are we supposed to do? So, as usual, relief of pain, give painkillers such as morphine or pethidine to relieve pain. So we are talking of narcotics, administration of narcotics, pethidine 50 to 100 milligrams, 6 hourly times 4 doses. 6 hourly times 4 doses, then you can switch into diclofenac. Provide patient with hot baths as it is variable for pain relief. Like we mentioned earlier on, that the patient should be given some seized baths as they also help in relief of pain. Observe for any hemorrhage which may occur if the ligature has slipped, especially after patient has opened the valves. In situations where some blood vessels have been tied using sutures, when patient intends to open valves or when the patient has opened valves, the sutures which were used to tie the blood vessels can slip off, and that can bring about bleeding. So when the patient open valves, we should take it a routine, a priority to inspect that the patient is not bleeding. As you are aware that hemorrhoids, they bleed a lot and the patient can bleed to death. Patients should be given diet with adequate fluids and roughage to avoid constipation, as straining as to may cause pain and bleeding. This is the point that I've already explained. It's just that it's coming under post-op, and we need to make it mention so that people can connect our discussion in trying to care for this patient who has just undergone hemorrhoidectomy. Check if patient is able to pass urine, as urinary irritation is very common after hemorrhoidectomy. So we need to observe the urinary system. If the patient is passing urine, because in this operation it's very common that patient may fail to pass urine because of the proximity in nature of the bowels and the bladder. The bladder can be traumatized and the patient may fail to pass urine adequately. So we need to monitor that. Advise patient to avoid heavy lifting of objects, as this can cause ligature to slip off and cause severe bleeding. Lifting of heavy objects should be discouraged by all means. This can predispose in slipping off of ligature, which can bring about massive bleeding to the patient, which can eventually lead to death. Let us look at the anal fissure and the fistula. Let us look at anal fissure and fistula. Anal fissures is a cut or tear occurring in the anus that extends upwards into the anal canal. Anal fissures is a cut or tear occurring in the anus that extends upwards in the anal canal. So fissure usually cause pain during bowel movement that often is severe. So what can cause the anal fissure? What can cause the cuts in the anal canal? Anal fissure are caused by trauma to the anus and anal canal during bowel movement with hardy stool. So in other ways, we are saying constipation is the cause of anal fissure. Also, it can be caused by insertion of instruments such as the sigmoidoscopy. When we are trying to inspect the colon, you can use the instrument, the equipment called the sigmoidoscopy. So, in trying to insert this, it can also tear the anal canal. During birth, especially in prime gravida, apart from sigmoidoscopy, our colleagues, especially those who are prime gravidas, when giving birth in the labor ward, the anal canal can be teared in the process of giving birth. Signs and symptoms. Severe anal pain. There will be too much of pain coming from the anal region. Patients are unwilling to have a bowel movement due to fear of pain. Here we mean someone feels like answering call of nature, but they don't want to do so because they know that when they go to the toilet, there will be so much pain that will be coming from the cut of the anal region. So they would rather wait as much as they can before they open the call of nature, just trying to run away from the severe pain that they can experience during defecation. Also constipation, because someone is going to take time to open bowels. The longer the stool stays in the rectum, the harder it becomes. So this will bring about constipation, and this will worsen the anal fissure because it will keep on cutting the anal canal. Signs and symptoms continues. Signs and symptoms continues. We're saying, moreover, constipation can result in the passage of a larger, harder stool that causes further trauma and makes the fissure ways. I'm just from explaining this point if you've been following me closely. There will be also blood in stool, like I explained in the previous session of hemorrhoids. There will be also blood in stool because the cut that has happened on the anal region, blood will be coming out. So the blood may also be mixed with it, with blood. The stool will also be mixed with the blood. How do we diagnose this? Diagnosis is by careful history taken from the patient. Also clinical presentation. Clinical presentation, which we've already mentioned, like there will be fear of opening bowels because of severe pain that is experienced during defecation. Also, a history of trauma during birth in prime gravidas that can also be a clinical presentation through his tracking that can lead us to the diagnosis of anosmia. Anoscopic examination can also be done. It can also help us to detect that. As well as sigmoidoscopy can be done as well to visualize the rectum and the sigmoid colon just to confirm the diagnosis. So treatment, steroidal cream reduce inflammation. We can apply steroidal cream to reduce the inflammation. Ointment with the muscles, with the muscle relaxant like nitroglycerin or glyceryl nitrate can be used. So these ointment, they relax the muscles of the rectum or the anal region. Surgical treatment, surgical procedure called partial lateral internal spherolectomy, sphincterectomy. Surgical procedure called partial lateral internal sphincterectomy can be done to repair the teared anal region. In this procedure, the internal anal sphincter is cut starting at its distal most end at the anal vag and extending into the anal canal for a distance equal to that of the fissure. So when you look at this operation, they focus much on the internal sphincter muscle, which is cut and repaired so that the problem can be solved. So in today's discussions, we've looked at hemorrhoids and the anal fissure. Unless there are questions, otherwise, we have come to our today's presentation. I thank you so much for your contribution and for paying so much attention. Thank you.